Cancer occurs when changes called mutations take place in genes that regulate cell growth. The mutations let the cell divide and multiply in an uncontrolled way. Breast cancer is cancer that develops in breast cells. Typically, the cancer forms in either the lobules or the ducts of the breast. Metastatic breast cancer is an urgent priority for BCRF researchers as the leading cause of breast cancer deaths. In this video, we're going to discuss metastatic breast cancer, its symptoms, and treatment. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash that like button and subscribe to never miss out on any of our videos. While it can be treated with more therapies and drugs available now than ever before, metastatic breast cancer remains incurable. It's important to remember that every cancer is unique and that your experience may not necessarily be the same as that of another breast cancer patient. With a personalized treatment plan, metastatic breast cancer is typically treatable. A recent National Cancer Institute study found that number of US women living longer with distant metastatic breast cancer is growing thanks to advances in treatments. Metastasis happens when cancer cells break away from the original tumor in the breast and travel to other parts of the body. These cancer cells travel through the bloodstream or the lymphatic system. Breast cancer can come back in another part of the body months or years after the original diagnosis and treatment. This is called metastatic recurrence or distant recurrence. In the US today, there are an estimated 168,000 women living with metastatic breast cancer, also called stage 4 breast cancer. In addition, 1 in 3 breast cancer survivors will be diagnosed with a recurrence, which can present itself in other organs of the body and be metastatic. Alarmingly, in recent years, there has been a rise in metastatic breast cancer diagnoses in young women. Nearly 30% of women diagnosed with early-stage breast cancer develop metastatic disease. Because there are so few cases of male breast cancer, it's not clear how many of these breast cancers metastasize, but men are also diagnosed with metastatic breast cancer. When the first diagnosis of breast cancer is metastatic, it's called de novo metastatic breast cancer. Being diagnosed with metastatic breast cancer can be overwhelming. You may feel angry, scared, stressed, or sad. Some people may question the cancer treatments they had or be mad at their doctors or themselves for not being able to cure the disease. Others may deal with the diagnosis of metastatic breast cancer in a matter-of-fact way. There's no right or wrong way to come to terms with the diagnosis. You need to do and feel what is best for you and your situation. The early signs of metastatic breast cancer may vary depending on how far the breast cancer has spread and what area type of tissue cancer has invaded. Non-specific symptoms can include fatigue, weight loss, and poor appetite, but these may also be caused by medication, depression, and any number of other conditions. If the breast or chest wall is affected, symptoms may include pain, nipple discharge, or a lump or thickening in the breast or underarm. If cancer is spread to bones, symptoms may include pain, fractures, or decreased alertness due to high calcium levels. If cancer is spread to the lungs, symptoms may include shortness of breath, difficulty breathing, coughing, chest pain, or fatigue. If cancer is spread to the liver, symptoms may include nausea, fatigue, swelling of the feet and hands, or yellowing skin. If cancer is spread to the central nervous system, which includes the brain or spinal cord, symptoms may include pain, memory loss, headache, blurred or double vision, difficulty with and/or movement, or seizures. There are a variety of treatment options for metastatic breast cancer, and new medicines are being tested every day. More and more people are living life to the fullest while being treated for metastatic breast cancer. While there's no cure for metastatic breast cancer, treatment may control it for a number of years. If one treatment stops working, there may be another you can try. Many different treatments alone, in combination, or in sequence are often used. Depending on the situation, your doctor may recommend taking a break in treatment when the disease is under control and you're feeling good. Women with hormone, estrogen, or progesterone receptor-positive cancers are sometimes treated first with hormone therapy. This may be combined with a targeted drug such as CDK4/6 inhibitor, everolimus, or a P13K inhibitor. Women who haven't yet gone through menopause are often treated with medicines that keep the ovaries from making hormones, along with other drugs. Chemo is the main treatment for women with hormone, estrogen, and progesterone receptor negative cancers because hormone therapy isn't helpful for these cancers. With so many chemotherapy drugs available, finding the right one for you would depend on your specific type of breast cancer. Chemotherapy is given intravenously, often in cycles throughout several weeks. Some patients tolerate it better than others. The first therapy given is usually chemotherapy in combination with trastuzumab, Herceptin, and pertuzumab, Perjeta, both HER2 targeted drugs. HER2-negative cancers in women are typically treated with a targeted drug called a PRP inhibitor, such as olaparib and talazoparib. Computed tomography (CT) scan is also known as a CAT scan. This procedure takes detailed pictures of internal areas of the body using a computer linked to an X-ray machine. A dye may be used to help the organs show up more clearly in images. The bone scan procedure looks for bone metastasis of cancer cells that have spread to the bone. A small amount of radioactive material is injected into the blood, then detected with a scanner. Positron emission tomography (PET scan) is a detailed imaging tool that uses a radioactive drug known as a tracer to search for cancer cells within your body. There are many different types of breast cancer. Oncologists will conduct extensive testing of tumors with sequencing and look at specific findings to understand what cancer might respond to best. Henry explains, more and more treatments are being developed and improved, so we have many more options for treatment now than we did just 5 to 10 years ago, Henry says. Yes, but only about 1 to 2% of all breast cancers occur in men, so the disease is not very common in men overall, but when it does occur in men, it can spread and become metastatic. An immunotherapy drug along with chemotherapy might be used in people with advanced triple-negative breast cancer whose tumor makes the PD-L1 protein. The PD-L1 protein is found in about 1 in 5 women with triple-negative breast cancer. Pembrolizumab might also be an option for TNBC that has other gene or protein changes. For TNBC that doesn't have any specific gene or protein changes, chemo alone or the antibody drug conjugate secukinumab, govitecan, Trodelvy might be an option. Immunotherapy drugs are designed to stimulate the immune system to destroy cancer cells in certain types of breast cancers. They're known as immune checkpoint inhibitors. In some cases, surgery or radiation may be recommended. Also, clinical trials may offer qualified patients the opportunity to receive state-of-the-art care and new treatments. Clinical trials supported by organizations such as NCI help doctors improve available treatments, comparing new methods and protocols with the current standard care. Tamoxifen has been an important endocrine therapy since fundamental studies demonstrated its activity against advanced MBC. A systematic review of 86 clinical trials found that patients treated with tamoxifen had an objective response rate of 34%. 19% of patients achieved stable disease for at least 6 months, although systemic drugs are the main treatment for stage 4 breast cancer. These can help treat breast cancer in a specific part of the body, but they're very unlikely to get rid of all the cancer. These treatments are more likely to be used to help prevent or treat symptoms or complications from cancer. Targeted therapies are newer treatments that work to block specific types of proteins or gene mutations that fuel breast cancer. You may hear the terms monoclonal antibodies, antibody drug conjugates, or inhibitors. If the cancer is no longer responding to one chemo regimen, trying another may be helpful. However, each time cancer progresses during treatment, it becomes less likely that further treatment will have an effect. Treatment to relieve symptoms depends on where cancer is spread. For example, pain from bone metastases may be treated with radiation therapy. Drugs called bisphosphonates such as pamidronate, Aridia, or zoledronic acid Zometa, or the drug denosumab. Ask your oncologist about the opportunity to participate in clinical trials, even if it hasn't been mentioned to you, Henry says. It's one way to get access to new exciting drugs, which may be beneficial. Because we have electronic medical records now, and everyone has fairly early access to documents like pathology reports, it can cause a lot of anxiety and be very confusing to a patient, Henry says. Sometimes a pathology report may say metastatic to the lymph node, but that may not mean it's stage 4. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Don't forget to subscribe to our YouTube channel. Stay safe, and we'll be back soon with another video just for you guys. Please click on the next video clip to watch for more health info. Thank you very much.